To start with, I'd like to begin with an acknowledgement that though we are doing this over Zoom, we are both, of course, standing on unceded Algonquin and Anishinaabe territory. So thank you again, once again, Dr. Tam, for joining me today on this. Let's start with the freshest question that Canadians have. Why is the evidence now pointing towards three-layer masks with a filter?
I think we're always continuing to use science and adjust our recommendation accordingly. So right now, the recommendation is essentially to add a filter layer, which is the third layer, as an added layer of protection. And so that's currently being put up on our website. And the filter layer, prior to this COVID pandemic, there wasn't that much interest in non-medical masks or masks that people can make at home. But in the last months, there's a lot more information and studies on different materials and different layers. And some of the studies, not just looking at filtration, but breathability, as well as one of the most important aspects of a mask is fit. You have to have it fitted well. So to make it a effective mask. So we're learning a lot more. And so this is just another update to the recommendations. And it's being updated because now we're into the fall season and people are moving indoors more. And we know that the closed, crowded, poorly ventilated environment where people may be face-to-face with others increases the risk of spread, and adding in more layers of protection, including a three-layer mask, will increase that added protection.
I want to ask a bit about the nature of evidence involved in public health decision-making. There has been some consternation among members of the public criticizing public health messaging as being, in their opinion, inconsistent. Why does the science underlying these decisions change, and how does public health evaluate that changing body of scientific evidence?
Yes, so managing a very complex and, quite frankly, a unprecedented public health event is very challenging. There's evolution in the science about the biology of the virus, but also other types of science, including social, behavioral, and other sciences as well. And so all of that has to be taken into account. And I think it's important for public health to acknowledge that what we recommended before needs to change as we shift. And that is not an easy thing to understand. I always said, decision-making in this complex environment, it results in the need to communicate as well as possible. Now, what is challenging is that in the first wave, there was much more consistency because we were asking people to stay at home, in effect. But as society opened up, and because disease activity is different in different areas, local public health are trying to balance the reopening of society with managing the transmission of the virus. And because PEI is not experiencing the same activity as, say, Toronto, those recommendations have to be tailored to what's happening on the ground. So that makes it more difficult. But just this weekend, all the chief medical officers and myself around the country published a statement which said, actually, our core public health messaging is very consistent, which is the personal measures that everybody should take to, keep your contacts small, where physical distancing, hand hygiene, wearing a mask as appropriate, staying home if you're sick, are very, very consistent. And those are kind of sustained habits, I think, that we need to build in. And we need to incorporate this for the time being into our everyday lives so that we can allow for more of the social and economic spaces to continue to function. And so there is a difficult balancing act. So that's what I'm saying, is that for the general public to know, it doesn't take much. If you had a party or a big gathering through which transmission occurs, and public health isn't able to respond to all those different contexts, you lose that balance. And that's when public health, when they can't trace everybody, is when they're going to have to sort of put in place some of those restrictive measures, which you have seen, of course, in some of the hotspots around the country.
Are you concerned that public health messaging, though it has at its core been consistent, may become part of this sort of endless news cycle of 2020? Most of the news coverage over the past week has been nonstop American election. Are you concerned that the message may be lost as part of this wave?
Well, I think we need to get the message out in many different ways. This is the sort of first pandemic of the modern age in the era of the internet and social media. And so that we know that public health voice has only a certain reach, and we need to get on board other people, other influencers, people who can reach youth, people who are elders in the indigenous community, for example, who can speak to their community. So there's many different aspects of the communication that we need to continue to improve and enhance on. And I think, reaching the younger age group and who may feel invincible, they know that maybe they have a milder illness, is to sort of reach them in different ways, but also for them to understand that, in fact, helping to reduce virus spread by reducing those big sort of party and social contact situation, observing all these public health measures, does help them keep open the educational institutions and some of the frontline work that they actually engage in, some of the food and retail sector and the frontline essential service sectors, grocery stores, etc. And all these different businesses also have a role to get the message out. So we need to really think in different ways. But one message I've been trying to get out now is that for the next months, we got to have a much more sustained response where people develop more, like this is just a habit. It's like putting on your hat and gloves, you're going to bring a mask, you're going to wear it. Becomes much more of a habit than it is a very different thing to do. And if everybody does their little bit and reduce virus transmission, we can keep our society open to the extent that we can be manageable. Another thing that I think people should remember that the healthcare system is trying to manage many things. It's resume elective sort of procedures, and it's trying to manage other people with other medical conditions. And so we need to make sure that we do our part in order to keep the health system functioning as well. So we need to look at different ways of which this message can resonate. Another, of course, key piece of information moving forwards is to keep the public informed about vaccine development and how the trials are going, how our regulators are evaluating. And just yesterday, the National Advisory Committee on Immunization published some of the initial thinking, preliminary thinking on priority groups. Now we're going to engage the public on seeing how do they react to that. And as we plan out the operational aspects of a vaccine program. So that's a new piece of communication that we need to continue to work on. But, I think all of my colleagues will recognize that we got to keep a sustained response, and we're not the only voices, and we need to get other people engaged.
I want to talk about the report From Risk to Resilience. One of the central conclusions seems to be that the pandemic is not affecting Canadians evenly, with health outcomes closely tied to one's affluence, occupation, community, those structural determinants of health. Given that many who work in public health already knew this, was Canada in a poorer position, a poorer starting position, due to those systemic health inequities?
Well, you're right. In this report, I was trying to point out that, this pandemic is not just a health issue. It's very much a social and economic issue as well. So health, social, economic well-being comes together. And the pandemic has shone a light and sort of made it more visible, I think, to the general public, even though, into our collective consciousness that equity is actually vital to the response itself. I think public health as a community recognizes that and is trying to be doing some of that intersectoral work. But I think now is the opportunity, because many members of the public have come to realize that we haven't sort of done enough in our systems to address inequities faced by seniors, faced by some of our essential workers who are often low paid in racialized population, often women, and people living with disabilities have been disadvantaged by this pandemic. In order to respond and reduce virus transmission, for example, you actually need to have the social and economic support in order for the public health measures to be effective. So I think that's the central message. And really no one is protected until everyone's protected is the bottom line.
Pardon me, when this report was released, I seem to recall that you called for the efforts that are being done right now to address those structural changes, those efforts to be extended through the pandemic and into recovery. Is this something that can be achieved with incremental change, or do we need a real foundational rethink of the way that we address public health?
Well, I think public health has been advocating for a much more holistic approach to health. And that it includes health in all policies, not just public health policies, but health needs to be considered in other policies. So it's something that we've been striving to do, but we do see that this pandemic has actually helped us connect between different sectors much better than we had before the pandemic. So for example, I advocated for some of the governance structures within different levels of government to continue. So very quickly into the beginning of the pandemic, many ministers of health, for example, in the federal government, the Minister of Finance, the Minister in charge of ESDC and Indigenous Service Canada are all at the table at the same time solving a complex issue. We need those similar intersectoral tables with the right leadership to carry on beyond throughout the response, during recovery, and afterwards, because what we want to do is to be more resilient before the next pandemic comes as well and learn from this. While building out public health capacity is very key, building up community resilience and the resilience in our most vulnerable and disadvantaged population is one way of achieving pandemic preparedness.
I want to talk about that community resilience because one of the interesting notes from the report was successful efforts from First Nations and Indigenous communities to combat COVID. Many of those communities would have factors one might normally expect to worsen a pandemic: elderly community members, multi-generational households, and in some cases a lack of clean drinking water. But there's this lower reported level of COVID hospitalizations and deaths on reserve. What can we attribute that to?
Well, I think there were certainly lessons learned after the 2009 H1N1 pandemic. There was, but very much is the decisive leadership in the communities themselves. So I think that's absolutely crucial because they made decisions about what they would do in their communities to prepare for the pandemic and to reduce spread. And when there are cases, there's a collaboration. One can always argue there needs to be more. Indigenous Service Canada, different federal departments, provincial as well, coming with different surge capacities. But really, I think recognizing cultural safety and other aspects as well. So for example, when I just remember very distinctively an outbreak in northern Saskatchewan where tests and point of care diagnostic was brought in very quickly. We had almost door to door sort of case finding. The community was behind this. The leadership decided on cutting down some of those gatherings and measures. In some communities, they actually did put together travel, if you like, restrictions and curfews just to get the pandemic under control. So you're seeing some of that community-led approaches. So we can learn a lot from that. we mustn't be complacent, because there are certainly increasing number of communities now being impacted in this resurgence. One thing I think I heard that has been quite successful is the youth leadership in indigenous communities as well. And they have a strong youth movement that's also contributed. So there's much to learn, and we need to just sustain our response for now. It's not forever, but for now, I think we're looking for everyone to play the part.
Now, disaggregated data with respect to race, socioeconomic background, things like that, that information seems to be crucial to some of the findings within the report. But as late as June, this was something that the federal government said it was only looking towards collecting, not that it was actively collecting. I'm not going to ask you to point fingers or blame anybody here, but why was this not already being collected as part of information gathered for public health purposes? What were the factors that perhaps made it more difficult to gather that information?
I think, initially there could have been a number of reasons. Obviously, when we looked at case report forms, there's an opportunity to fill in those data fields. But people was focusing on some of the very core data sets that was needed to look at where this epidemic was going in order to, enact some local public health response. But now the Safe Restart Agreement, for example, there was some financial support and capacity support so that local and provincial levels could get the information collected. I think that's important because there's capacity requirements also to collect that information. The other thing is how the information is collected, because if you do not engage communities and have the proper objectives set out, and that the information is to assist the individual communities, then it's not going to be particularly helpful. So consultations and engagement are important on that front as well. And of course, the respect for privacy, etc. But I think it needs to be done. And so in our new national core data sets, and having had this injection of some resources, race, ethnicity data is a very, very much part of the core data that's collected. You've seen, I hope, Statistics Canada coming out now with some of the data showing some of the disparities in the impacts for visible minorities, for example. You've seen Toronto, you've seen other cities being able to collect data at a more granular level, showing some of the disparate impacts on the areas of the city with higher levels of poverty or low income. That helps the city be able to target its resources and provide additional support in those areas. So that's a very practical way that people can get behind in terms of collecting that information. And also, some of this information cannot be gathered just by sort of surveillance reporting, and it can be done by researchers. So there are some really great research now from Indigenous researchers and Indigenous scholars collecting information on the impact of COVID-19 in the urban First Nations, Métis, and Inuit populations.
On an individual level, earlier this year, you were the target of an attack that was racist in nature from a member of parliament, alleging that you were working for the communist Chinese government rather than for Canadians. As somebody from British Hong Kong, who, to my knowledge, has no connection to mainland China, was that frustrating to hear while you were trying to get this important public health messaging out?
Well, to be honest, I was really very much focused on the public health response. So that was really preoccupying me. So I was so focused that it wasn't really something that, I paid too much attention on. But I think it's a broader message that, I talk about social cohesion and the importance of that in my report. and for countries that are successful, maintaining that trust in the public health leadership, and so that the population can get the credible information to play their role is really, really important. So I think, we need to be mindful of that. And I do think that the vast majority of the Canadian population has been doing very well and is behind the public health response, and that just needs to continue. But and as an individual, I was really very, very busy just focusing on doing my part in the public health response.
Is there anything that I've not asked you that you feel like is particularly important to communicate at this time?
Well, I think what's important is to, as I said, develop this sort of sustained path forwards, because this virus is going to be with us for some time. We know that the level of immunity in the Canadian population is low through some of our studies on the antibody levels, which means that while we're still working on vaccines, more new treatments, I think both public health and every individual have to work together in order to keep the virus under control while trying to, allow our, lives to function in safer but more normalized ways. So I think, we've got a few, culturally important events coming up in different communities. We just had Thanksgiving and Halloween, and we have many more of these celebrations to come, including Christmas. And my perspective is that if we all do our part, we can still connect socially. Those social connections are important, but in a safe way. So plan ahead so that we can still enjoy those social connections, but just do it differently for this year.
Thank you very much for your time. I've been speaking with Dr. Theresa Tam, Canada's Chief Public Health Officer.